Hi, my name is Dr. Landon Pryor, and I'm a board-certified plastic surgeon. And on this channel, we discuss luxury self-care practices of all forms. Welcome to today's conversation about the 5 benefits of vitamin B12 injections. Be sure to subscribe below and leave any questions you have about IV vitamin infusions or vitamin B12. If you're struggling with weight, fatigue, or mood changes, vitamin B12 can help you feel better. So here are the top 5 benefits that you're going to notice after supplementing with vitamin B12 injections. So vitamin B12 helps to fortify your diet. Many Americans don't get sufficient B12 in their diet, and it's not something your body can make on its own. So it definitely helps augment your dietary intake of vitamin B12. Whether or not vitamin B12 directly helps with weight loss is somewhat controversial, although all of the vitamins play an important role in regulating metabolism, so a deficiency in any of them can potentially contribute to an unhealthy metabolism and ultimately weight gain. So it's important that you maintain healthy eating habits and supplement your vitamins as much as you can to minimize risks for weight gain. So vitamin B12 can give you an immediate boost of energy. We like to give it to patients in the morning so that you don't have problems sleeping with it. While you can see energy fluctuations right away, typically it's more of a gradual increase in baseline energy over time. So in our experience, vitamin B12 can help patients feel better. It regulates mood and minimizes risk for depression. Patients have more energy and just feel more like their normal self. So B12 is well known to be needed for appropriate bone health, so it's important to maintain your B12 levels to prevent different types of anemia as well as bone density issues. So vitamin B12 with appropriate dosing is great for skin as well. It helps minimize risk for acne and hyperpigmentation as long as it's not overdone, which can also cause more skin problems. And of course, vitamin B12 helps with healthy hair and nails, so that's definitely something you want to maintain routinely to have the best look possible.
Hi, my name is Skylar. I'm a nurse practitioner here at Pryor Health, and I'm going to be answering some frequent questions that we get about B12 injections. So why do we need B12? B12 is not naturally produced in the body. We actually get it from the food that we eat. B12 is essential for DNA production and also helps with the production of our red blood cells. Who's at most risk for B12 deficiency? Those who can't absorb the nutrient and also those who follow a vegetarian or vegan diet. B12 is found in animal products such as fish, shellfish, red meat, eggs. So oftentimes if you're a vegan or vegetarian diet, you are lacking in B12. So what are the most common symptoms of B12 deficiency? Most common that we see here are tiredness and fatigue. The biggest recommendation I can give someone is to definitely check with your primary care provider first. They can often take a blood test that shows what your B12 level is at and if you're deficient or not. What's the difference between the injection or the supplement? Honestly, you can take a supplement every day, that's fine. A lot of times though, if patients are really low in B12, the injection is kind of the way to go. It gives you that one-time boost into B12 and you don't have to take a pill every single day. It's a little bit more potent right then and there. Whereas usually with a supplement, you're taking about 1,000 micrograms a day. So as a patient, what can you expect during your B12 treatment? It's a very fast appointment. You come in, we talk about any concerns that you may be having, especially if this is your first time. Talk about any supplements that you may already be taking. It's just a 1 milliliter injection where we're putting it either in your deltoid or back here behind you. It just depends on what muscle you would like. And you're out in the door within 15 minutes. So we have B12 here. This is the purest form of B12. We offer other different types of B vitamins. You know, from here we just pull up 1 milliliter, which is 5,000 micrograms. And that is usually, you know, placed in the deltoid. Pretty fast and easy. The solution is about a pinkish reddish color. And you're out here with a little Band-Aid on your arm within 15 minutes. It's probably the easiest thing we do here.
So vitamin B12 is very safe. It's not something that we would typically monitor with regards to levels prior to or post-infusion treatment, although certainly that's something that can be done if you want to be more objective in your treatment. Like most things, you should not do it at home on your own. B12 is not safe to supplement other than in oral supplementation form. At Prior Health, we actually do injections of vitamin B12, which is much more effective. So that's not something that you're going to want to do at the house by yourself. Generally speaking, vitamin B12 really helps patients that are deficient in vitamin B12, and like we talked about many times, that's not appropriately supplemented in the typical diet. So you may not know that you're deficient in vitamin B12, but providing supplementation for it on a routine basis can minimize risks of development of symptoms. If you enjoyed this video, leave a like below. We'd love to hear your questions in the comments. And subscribe to stay tuned for next week's show. See you next week.